Since March, when COVID was confirmed in the country, Plan International, as an organization, we considered what could be doing, what we could be able to do, and support the government to respond to the crisis. So following the government guidelines, we went in to develop an emergency response plan for the COVID response for the country and be able to see how we could be able to intervene towards the pandemic. Started with the wash interventions, the hand washing promotion. We managed to procure tanks to supply to the hand washing stations, and we managed to have around 21 hand washing stations for Kayole and Kibera.
In as much as COVID-19 is a health pandemic, we have seen the ripple effects on society. It is both a social issue and an economic issue as well. And we have been very deliberate about ensuring that in our interventions, we also seek to improve the resilience of the households that we are working with, and also the resilience of girls. In particular, in some of the counties we've been working in, we've provided cash transfer programs for over 12,000 families to ensure that they are able to put food on the table and to meet their basic needs. We've also, in interventions such as this, water and sanitation and manning points here, we've been very deliberate about targeting and identifying young women and adolescent girls to man these water points, and they get a stipend for it as well. So that again allows them, especially if they are young mothers, to meet their basic needs and to feed their children.
On a normal day, I open at 8 a.m. in the morning. I set the station, go fetch water for the exercise, and close at 5 p.m. in the evening. The turnout at this hand washing station is good, with approximately 600 people washing their hands daily, the largest percentage being the children. The allowance I receive from Plan helps me to manage a lot of things, since I can buy sanitary towels, food, pay my rent, and also manage my daughter.
Tangu hii project ya hand washing ikuje, imenisaidia pakubwa. Juu first nilikuwa nakanga tu kwa hao, unaona niko na mtu hii, saa imenisaidia kukosa kuwa idle. Naweza provide kunoa maziwa, pampers, nikilipwa. Then kusaidia community, wase wengi hawakuwa wananawanga, but sasa nimewa encourage wananawa daily, watoto wana participate, watu wakubwa. Sasa naona ni kitu poa sana, naweza taka iendelee kugrow.
The Shower for Girls project is one of the interventions we took into our emergency response plan as well. Why? Because back at home, remember, the pandemic is still hitting, and therefore the resources to get more water for the girls and meet their hygiene standards becomes a challenge. We supported the payment of the washrooms for them. They could be able to go in and shower and then maintain their proper hygiene as they go on with their lives.
Before tuanze kupewa hizi sanitary pads na sabuni, some of the works that mademu wanakuwa involved, wasichana wengi, ni kama tuseme ni kufua, kwa sababu unaweza pata hana pesa ya kubuy hizo pad, na pia kuna wengine wame-involved kwa sexual intercourse na watu wa nje ndio wapate pesa, imelead to early pregnancy, imelead to many school dropouts. At least hii tuna focus, hakuna any issues, hakuna kuwa stress kwa sababu tuko sure tunapata, tunaoga na pia tunapata sabuni.
Coronavirus has affected my menstrual hygiene in that I used to receive the sanitary towels from the school. And now, since I'm at home, I depend on my parent. And my parent is also at home. And at the same time, we need to feed. So you'll find that a parent will sacrifice that 100 bob to buy flour than to buy your sanitary towel. For me, I must say that I'm lucky because Plan International has helped me access the sanitary towels and the soap. So for me, I'm lucky, unlike maybe other girls.
Let us not lose our future because of our nature.
We are privileged again to receive a lot of support from Plan during this COVID-19 time. We have received 10 tanks for the hand wash stations. The 10 tanks have the 10 stands for the tanks. Again, we have received 500 liters of soap. We have received 1,000 masks. And in addition, we went ahead and received 1,000 pieces of sanitary towels and 1,000 pieces of innerwears The sanitary towels and the innerwears come in handy for the adolescent girls and the young mothers in the community. We understand during this period of time, majority of them are not able to afford these basic needs. One of the major challenges that we've experienced during this time is the scarcity of the resources, because we got only 10 hand wash stations, and these ones are supposed to be spread out through the 4 wards. The 4 wards are quite big, and so there were very few, and we really spread them out, and we felt like we've left out a bigger chunk of the area of the population, because not most of them will be able to access them to where they are.
We have been looking at the trends in the country, and the cases are still going up, and the transmission is really affecting the local people, it's informal settlement, and to date we have 44 counties affected. And what is really looking like we could get an extension, or we could ask for an extension of the emergency response plan until the end of the year, so that we can support the response within the counties and within Nairobi.
I appreciate Plan International for this great initiative they have brought to our community. It has really helped us in keeping hand hygiene. We are washing our hands and sanitizing more frequently than we used to do before the station was brought up. I also thank them for bringing us a stable source of income in these hard times of coronavirus, and hope that they will keep doing more projects like this for the youth to benefit.